We're turning now to what elected leaders are doing to slow the virus down.
Yesterday, we had some big announcements from Governor Abbott and President Biden. Ugochi Aloka joins us live from a new testing mega site at Butler Stadium. And Ugochi, good morning to you.
Hey, good morning, Kimberly and Steph. Well, this new mega testing site here in Southwest Houston, which you really can't see very well right now because it's so dark, opens up in just a couple of hours, and it's expected to test up to 1,000 people a day for COVID-19. Now, this is just one way that shows that more help is coming. Now, Governor Abbott, of course, asking the feds for more testing help, and hopefully we understand his wish could be granted very soon, with FEMA stating they'll open 6 additional testing sites in Texas by next week, and one of those will be in Harris County. Meanwhile, reports from the White House state President Biden is working on other help, including Pfizer's COVID-19 treatment pill. The president says the U.S. will be ordering 20 million treatment courses of that pill, with half set to be available by June.
These pills are going to dramatically decrease hospitalizations and deaths from COVID-19. They're a game changer. Our supply is going to ramp up over the coming months as more of these pills are manufactured.
With the Omicron variant impacting medical staff, causing over 1,000 who had COVID to miss work last week at Houston Methodist, Governor Abbott is also asking the feds for more medical workers. But so far, Houston is not on the list of overrun hospitals who will receive military doctors and nurses. And also, Governor Abbott is suing the Biden administration in order to block their federal vaccine mandate for Texas National Guards. We understand that this is something he's really pushing for, so we will keep you posted on updates on that, as well as updates on COVID testing reimbursements soon. Kimberly?
We know you will. Ugochi Aloka live for us from Butler Stadium testing site this morning. Thanks so much. And at 5:06, here are your other coronavirus headlines, counting down from number 3. The cost of some at-home tests are going up. Walmart, Kroger, and Amazon had deals with the Biden administration to sell the test at cost, but the agreements have expired, so they bumped the prices. Number 2, promising news from an Israeli clinical trial. The vaccine trial showed a 4th dose gives a big immune boost. In fact, the additional dose of the Pfizer vaccine gave 5 times more antibodies. And number 1, the CDC updated its recommendation for when many people can receive a booster shot. The agency shortened the waiting period from 6 months to 5 months after your second Pfizer shot. That recommendation comes as researchers learn of a new Omicron-specific symptom.
Brandy Smith explains why these variants are showing up in different ways.
Why are people infected with the Omicron variant showing a strange new symptom? At this point in the pandemic, we're all pretty familiar with the symptoms of COVID: fever, cough, and a loss of taste and smell. But now that Omicron is the dominant strain in the United States, people are starting to report a symptom often associated with a litany of other conditions: night sweats. That means repeated episodes of extreme perspiration, often leaving your clothes and sheets soaked with sweat by the time you wake up. The change in symptoms was first noted in Britain, which was hit with Omicron before it quickly spread to the U.S. Doctors with the country's National Health Service now say night sweats are a sign you should go get tested for COVID. The other symptoms most reported with Omicron are sore throat, headache, and fatigue. Common COVID symptoms like loss of taste and smell don't appear to be affecting people infected by this new variant. The good news is there is growing evidence that Omicron causes less severe symptoms. The research shows the extremely contagious variant is more likely to infect the throat than the lungs, meaning it's doing less damage to the lungs. So far, these studies haven't been peer-reviewed, but researchers believe Omicron's mutations have changed its ability to infect different types of cells. Experts still warn we shouldn't be lulled into a false sense of security, because Omicron remains a very real global health threat. With The Why, I'm Brandy Smith.